The Maternal Mental Health Alliance is a coalition of over 85 national patient and professional organisations who are all committed to speaking with one voice about the importance of maternal mental health and the importance of us all doing something to improve the lives of women and their infants and their families. There are huge challenges across the UK in getting better care for women with perinatal mental health problems, and that's right across the board, across the whole of healthcare. So from universal services, as we call them, health visitors and midwives, being able to provide not just good, humane, supportive healthcare, but also being interested and having an understanding at an adequate level of the sorts of mental health difficulties that women experience at this time, and being very willing to listen and asking, because women are very reluctant to talk about these difficulties for a range of different reasons. Most commonly, the fear that somebody's going to take their baby away from them because they're not entirely mentally healthy and well, which is of course ridiculous, but a very common worry. So midwives, health visitors, GPs, most GPs don't get training in mental health, let alone in perinatal mental health, and yet they see huge numbers of women with these sorts of difficulties. And then in specialist mental health services, we have inadequate provision of the most specialised type of care, community teams for women with very severe illnesses during pregnancy and postnatally, and we don't have enough mother and baby inpatient units. So we still have women in the UK who, if they need to go into hospital, are forcibly separated from their infants, which at this critical time in their lives is a horrific thing to happen to them. So we've got a lot to do, but there's a great deal of commitment from a lot of people, including government at this stage, and from the NHS itself. And I have no doubt that that change for the good is achievable, and that we can transform the lives of women and their infants. What we do reasonably well in health and social care is siloed thinking. So if we have a problem that can be solved by one person, they'll very often go out and do it, because we have the best will in the world in our NHS and social care system. What we don't do so well is working closely together to solve complex problems, either at an individual level and particularly at a population level. And what we do least well of all is prevention, genuine prevention, where we stop suffering at all. That applies in mental health as in the whole of health. And the only way to solve that problem is through intelligent conversations and through people being well informed and working with the evidence that our academics and researchers provide us with in order to deliver better, integrated, comprehensive care. And there is no reason why that can't be achieved in mental health care. We just need to get on and do it. So thank goodness there is still time for us to reflect, for us to converse, for us to be creative, and for us to leave enthused with a determination to make change happen. Well, I think what's striking about this meeting is the wide variety of people who've come from all sorts of different walks of life, the third sector, the community and voluntary sector, NHS services, social care services, all coming together to listen, to learn, and to creatively start to think about solutions that are going to apply over the next year, over the next century, to make people's lives better.